Hi, and welcome to this video on cognitive fallout that may occur after a stroke. My name is Cindy and I'm a speech therapist, and together with our colleagues in occupational therapy, we are involved in the rehabilitation of some of these various cognitive symptoms. Physical symptoms such as weakness on one side of the body can be easier to understand because you can literally see it from the outside. Unfortunately, that is not the case with cognition. Cognition by its nature is complex and nuanced, and different cognitive functions are interrelated with one another in ways that we still don't really fully understand. But having a basic concept of cognition and the cognitive fallout after a stroke is really important because a stroke survivor's cognitive function underpins everything that they do. We know it can be confusing, difficult, and even frightening for families when their loved one acts out of character after a stroke. Our aim in this video is to help you understand cognitive fallout after stroke just a little bit better in order to prepare you for the recovery process. With many strokes, there can initially be a period of decreased consciousness or awareness. This can be due to the effect of the stroke itself, but also because of secondary symptoms, like for instance, swelling in the brain. Fatigue is also a common symptom after a stroke, and a stroke patient's endurance can be quite poor. And as they fatigue, there can be a lot of fluctuation in their functioning. A stroke survivor might also be disorientated in the immediate aftermath of a stroke. This means that their awareness of themselves in time, space, and person can be affected. They might not fully understand where they are or what's going on around them. Generally, orientation slowly improves in the days or weeks following a stroke. When we look at the specific cognitive symptoms that a stroke survivor presents with, this is dependent on exactly where in the brain the stroke occurred, as well as how severe that stroke was. Even though cognition is complex, it is helpful to simplify it and look at different areas of the brain, what its function is, and how a stroke in those areas will affect a person's cognitive function. Firstly, we can differentiate between strokes in the right hemisphere versus strokes in the left hemisphere. You may remember from previous videos that a stroke in one half of the brain may lead to physical and sensory fallout on the opposite side of the body. With a stroke in the left hemisphere, we would thus expect physical fallout on the right side of the body. The left hemisphere of our brain is our logical side. It is involved in analytical thinking and language. A very common symptom of a stroke in the left hemisphere is aphasia. You might remember this term from one of our previous videos. Aphasia refers to language problems, and depending on exactly where in the brain the stroke was, a stroke survivor may struggle with retrieving the correct words to express their thoughts. They might struggle to understand spoken language, and they might struggle with written language, reading and writing. A speech therapist is generally involved in the rehabilitation of people with aphasia, and the focus falls on not only improving language as much as possible, but also helping the stroke survivor communicate with their loved ones by any means possible. Now let's look at strokes in the right hemisphere. This will lead to physical and sensory fallout on the left side of the body. The right side of our brain is our creative side. It is involved in emotional and sensory processing, especially the processing of visual and spatial information. Common difficulties after a right hemisphere stroke can include visuospatial difficulties. This can make it really difficult for a survivor to perform daily tasks and function in their environment. Right hemisphere stroke survivors may also present with neglect syndrome, where they ignore one side of their body or the space around them. They might, for instance, only eat half the food on their plate, or not be aware of objects or people on the affected side. Occupational therapists are heavily involved in the rehabilitation of perception and visuospatial difficulties. Another way of looking at cognitive difficulties following stroke is looking at the different lobes of the brain and what their function is. Each hemisphere has 4 lobes: the frontal lobe, parietal lobe, temporal lobe, and occipital lobe. Our frontal lobe is important in emotional regulation, as well as higher cognitive functions such as executive functioning. Executive functioning is a difficult concept to explain, but it's helpful to think of it as all those skills that a manager of a really big organization needs to be successful. When you have a stroke in the frontal lobes, executive function might be impaired. This may look like difficulty in planning, organizing, prioritizing, and problem solving. Changes in personality and behavior is also common after frontal lobe stroke, and the stroke survivor may present with mood swings, impulsivity, and on the other side of the spectrum, apathy. We know that behavioral changes can be especially difficult for families, and we hope that knowing where this comes from is helpful in navigating this. A stroke affecting our parietal lobe will influence our perception and ability to interpret sensory information. The stroke survivor may struggle to make sense of sensory information and engage with the world around them. A stroke in our occipital lobe will result in difficulty making sense of visual information coming from the eyes. When this occurs, a person may have difficulty in visual field or recognizing objects. In severe cases, when both the left and right occipital lobe is affected, it may lead to something called cortical blindness, where there can be significant or even total loss of vision. Our temporal lobes are, amongst other things, essential for memory, and a stroke in the temporal lobes may lead to difficulty making or forming new memories. So a stroke survivor may struggle to recall recent events or conversations, and obviously this is going to have an impact on their ability to cooperate in rehabilitation and for carryover to occur. Lastly, it is important to note that the recovery of cognitive symptoms following a stroke is a complex process, and it is very specific to an individual. Generally, a multidisciplinary team is required, with a family central in that team. It is very difficult to predict how a stroke survivor's cognitive abilities will improve. It often takes time for the full effect of a stroke to become clear. But with adequate support and the right therapies, many stroke survivors make huge strides in improving their cognition. If your loved one has suffered a stroke and presents with some of these cognitive difficulties, we hope that this video has helped you understand cognition and cognitive fallout after stroke a little bit better, and that this helps you navigate the recovery process.